Gender-affirming surgery, we're going to be doing a full body lipo with rib remodeling to really improve the waist to hip ratio. I really focus on that a lot, WHR, because that's really the crux of body fem, is what is the proportion or ratio of the waist relative to the hips. For the waist, we can use both lipo and remodeling of the ribs to make it more narrow or to decrease the circumference. For the thighs, our main tool that we can access is fat grafting. So we're going to reduce the fullness based by pinch, thin this out, bring in the waist proper as much as possible. Usually the point of maximum flexion is right around the belt level of the belly button, and then we're going to expand the thighs as much as we can. Alright, so you can see we've lipoed and done the rib remodeling on one side, so you can see the difference in contour. This is going to come in a little bit more. Even though she's laying down, you can still appreciate that nice change in the silhouette. Gender-affirming surgery, we're going to lipo the upper back, mid-back, waist, create a nice contour in the waist, and transition to thighs. And the thighs we're going to expand as much as we can. Remember that the rate limiting step of expansion is usually how tight the skin is, or distensibility, how much the skin will stretch. Before doing any rib procedure, we always get a CT scan. So this is a CT scan with 3D reconstructions. We count how many ribs there are. There's 12 ribs. One of our patients had 11. Then we measure out kind of where the angulation starts to really bend on the rib. So somewhere around here is the angulation, and we measure it out. It's about 8 to 10 centimeters. So this is around 8, this is around 10. And this is something, so when you break the bone, it's a monocortical fracture, meaning just the upper part's broken, but the part on the bottom is still intact. So it creates an angulation. When you heal, if you don't wear the garment, it's going to go back to this, right, straight. What you want to do is heal while the bone is angulated. That angulation is what allows the angulation right here to bring in, is what allows the waistline to narrow. That angulation is maintained by wearing the corset. Alright, you can see nice improvement in the waist. So we did rib remodeling 12, 11, and 10. Expansion of the buttock. Again, we went for max expansion, which is based on tissue distensibility or tissue stretch or tissue compliance or expansion. You could fill in the word you like, but the point is, however much we can stretch the skin, that's the volume we get. On average, about 1,000. That's what we did on this case. And you can see nice improvement in the waistline from the remodeling with adjacent liposuction. Reduction in the waist with rib remodeling and lipo, curvature in the thighs from fat grafting. This is a gender-affirming surgery. You can see we have a nice improvement in the waist to hip.
Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.